Hello, I'm Dr. Aravinthan, consultant urologist. This video we are going to talk about benign prostate hyperplasia. So today we will discuss about what is BPH, what are the symptoms, how patient present, how we diagnose, and what are the treatment options. Benign prostate hyperplasia, the name itself, it's benign, it's not cancer. So the prostate enlarge with the age, and the prostate gland is located in the under the bladder, and it surrounds the urethra. So when it enlarges, it compresses the urethra, and it gives symptoms. So BPH is not uncommon. So most of the men at the age of 50 have some elements of BPH. The papers say around 90% of men at the age of 80 have some elements of or some symptoms of BPH. Risk factors are the family history, obesity, some hormonal changes, and aging. Right. How the patient present when they get the prostate enlargement? First thing is they noted their urine flow is reduced, and with the time they feel urgency, urge incontinence, and the nighttime urination, and at the end of the worst scenario, they present with retention of urine or urinary incontinence. When they go to the clinicians, the clinician will examine the patient, especially they put the gloved fingers into the rectum and assess the size of the prostate, and we arrange an ultrasound scan to see the residual volume, how much urine the remaining in the bladder, and urine flow rate, that will tell us the exact flow of the patient. And if we have a doubt, we do the PSA blood test to exclude any cancer related to the prostate. With these investigations and the clinical history, we can make a clinical diagnosis of BPH, and we can grade your disease, whether it is a mild symptoms or moderate symptoms or severe symptoms. It depends on the symptoms. The clinician or urologist categorize this patient into 3 groups: the patient having mild symptoms, moderate symptoms, and severe symptoms. The first stage of the disease can be managed with lifestyle modification. So lifestyle modification includes the regular exercise, fluid intakes. That means that we restrict the fluids at the just before the bedtime. And foods, we advise them to avoid caffeinated drinks, fizzy drinks, and some oxalate foods, and some drugs, especially the drugs which can make more urine in the night. So in this way, we can control roughly around 80% of the symptoms of stage 1 disease of BPH. The patient with moderate or some portion of severe symptomatic patients will be benefited from medications. There are 2 groups of medicines available for the management of BPH. One is alpha-1A receptor blockers. It's called the tamsulosin. So what tamsulosin does, it relaxes the prostates and help the patient to pass urine without difficulties. The second group of medication is a finasteride. So that try to shrink the prostates and help to pass the urine a little bit better. Some special cases or selected cases, the urologist combine these medicines to manage the patients with mild or severe the moderate or severe symptoms. If the patient not responding to the medications, some patients may go for 2-3 years, and after 2-3 years they say they are not improving with medications. Or patient at the beginning not well respond to the medications, can we go for surgical options? The surgery is simple because of the advancement of technology. Now the surgical options for the BPH is simplified, and most of the time it's a day case procedure. The TURP is it's called the transurethral resection of the prostate, is the gold standard for the management of BPH. TURP, even though I say it's a simple procedure, it's a surgery. So surgical options have its own complications. So pain, bleeding and infection are a little bit common with TURP, but with the advancement of technology and the skills of the surgeon, now this complication rate is coming down. So I can say it's roughly around 1 to 3% of complication now we are seeing in the common population. So after the operation, patient will be given a catheter which should be carried for at least 2 to 3 days. After that, we remove the catheter in the local clinics, and patient will be seen in the clinics in 2 weeks' time with the histology. Hope you enjoyed this video, and I have given very basic information about the benign prostate hyperplasia. If you have any questions, if you want to know any further details, please feel free to WhatsApp to me to my number, and you can find me in Facebook and Insta. Thank you.